Hello again, Pinoys and NZ. So let's talk about OET, different from IELTS. So we can discuss the reading, speaking, writing, and listening
Okay.
part of.
So in the listening test, in the OET, what you're going to expect is that there are actually three different parts. So in part A, okay, you're going to hear a consultation between a healthcare worker and a patient. Now, you might be wondering, like, it may be like a visit to the clinic, but it's not designed to be like their first time. Usually it's a referral or a follow-up, okay? The reason for that, during our OET teachers training, the reason for that they have designed the test, it's because if the listening audio is about a first time consultation, even if you didn't hear the word, but we already know like what those symptoms mean. I mean, what do those symptoms signify? What illness do they signify? So let's say in the speech of the patient, he says, I'm having problems with breathing, and at the same time I just ate peanut butter. So in your head you already have an idea that it might be an allergy, right? Okay, or probably asthma, we don't know. But at least I mean, like, you have derived that answer not because you listened to it, but because of your prior medical knowledge. That's why they designed that part A, or they don't call it part 1, they call it part A of the listening test, to be either a referral or to be a follow-up visit. Okay, and then it has also 2 extracts. The part B is also a it's a multiple choice, and it has 6 different items. So in all of those items, it has its separate audio. So basically you have 6 different extracts, and it could be, I mean, like, most of the time it's a conversation, all right? And then in a way they are using workplace English, all right? So it could be between a radiographer and a consultant, and there's a question there, then you have to find the answer. This is in contrast with part C, because part C, the audio there is more of a medical lecture, okay? So in the medical lecture, it could be like only, the person is the only one talking in that audio, and then the other audio is that it could also be an interview. So the good thing about interviews is that every time that the interviewer asks the question, it actually is like a clue that you're off to the next number. But in contrast, if it's only like one person giving a medical talk, all right, you really have to listen carefully to what the speaker is saying, so that you just know which part you are already in. That's why when you answer the listening test, you have this, what we call the pre-listening, during listening, and after listening. In the pre-listening, usually you have 30 seconds, okay, to look at the questions. Actually, it differs with different parts. Sometimes, if I'm not mistaken, in part A, it's around 10 seconds or so. But definitely, for part C, it has a longer duration because it has more items. And then, so what you do in those seconds in the pre-listening is to look for the keywords. Alright, because those would serve as your signpost. You know already which part the audio is in because of the keywords. And when you talk about keywords, I mean here, what I mean here is the content words. So content words are nouns, numbers, figures, okay? These are the words that give information, in contrast to auxiliary words. Auxiliary words are just mere connectors, like in, on, at, preposition, and so on. So don't underline everything. You have to be strategic. Okay, those keywords must be unique with that item alone. It mustn't be repeated in any other items Because if that is the case, how else will you know that you already are in the right number? Okay?
Correct.
So, that's what I can say about in the OET listening. So when it comes to preparation, skills building, I highly suggest that you listen to Australian Prescriber. That's a podcast. Actually, there are so many other podcasts, but when I listen to Australian Prescriber, I like it in a way that their podcast is clear. Because there are some other podcasts that are, because it's recorded from a radio show, so there are some sometimes like vagueness in their recording. So Australian Prescriber is what I would suggest. They should give me a how do you call it, like a fee. Commission fee. anyway, again, going back to the Australian Prescriber, you could listen to them in the Spotify. I listen to them in the Spotify, and then if ever that you have difficulty at first in catching up with the accent in Australia or New Zealand, you try to reduce the speed first, because in podcasts, even in YouTube actually, you could adjust the speed. You try to look like there's 1x. When you click on that, there's 0.8x, 0.5x. You try to click 0.8. It would somehow slow down. And once you're able to catch up with it, try to go back to the normal. Okay?
Nice technique.
Yes. You know, for most Filipinos, we don't have a problem with American English because that's what we have been exposed to. But when it's our first time to listen to an Australian English, you know, or to New Zealand English, it's really like difficult for us. Okay? Honestly speaking, it was my first time to listen to an OET listening test. You know what's in my head? That's really how it sounded like. I panic. Oh my God, what is this? But then, you know, you just have to take it step by step. It's really more of exposing yourself and just really taking things through slowly. Okay, as long as you're able to understand what you're studying, what you're trying to learn. Okay, don't really rush things. Okay. All right, so that's for the listening test.
Listening test. So now we can talk about reading. Reading.
Okay.
In OET.
Okay. So in terms of the reading test, okay, it also has 3 different parts. They call it parts A, B, and C. In part A, you're given a 20-item test with 2 booklets. One booklet is the text booklet, and the other booklet is the answer booklet. In the text booklet, you'll find in the main page, of course, there's a cover page, right? But in the first page, you have there the overall theme. Let's say the theme here is about asthma. And then you have 4 short texts entitled as Text A, Text B, Text C, and Text D. And these are very short reading material that you can usually find in the hospital setting. So it could be a procedure on what to do. What I mean is that, like, if it's an asthma attack, like, what do you do if the patient has difficulty breathing? This is what you do. It's like the procedural.
It's like the protocol of the hospital.
Protocol on what type of healthcare treatment plan are you going to give. It could also be like the text to be about the drugs, okay, included in the treatment plan. It could also be actually, it just has to do with the main theme. In that case, my sample was the asthma. And then in your text booklet, okay, you have the 20 items, right? And then in the first 8 questions, it's a matching type. And then in the next 6 or 8 items, that would be like an open-ended question. And the last 6 or 8 items, that would be a fill-in-the-gap type of question. So the challenge here is that you have to answer all 20 items in 15 minutes. So imagine that. You do the math. Basically, for every item, you have to answer it at around 30 to 45 seconds. So would that be possible? Of course. That's where the teachers are for. And there's, of course, a technique for that. And basically, the skills tested here would be your skimming and scanning. you're not expected here to thoroughly understand the text material. If you do that, you're gonna consume so much time.
Yeah.
Okay, and
More
then
than an hour maybe.
you save that kind of reading later for parts C. Okay, parts B or C. Okay, all right. So that's for the part A. Next, you know, after the 15 minutes, the invigilators would have to collect the papers. So you have no choice but to really answer as many as you can within 15 minutes. Okay, then after that, they're going to give you altogether the parts B and C, and you have to answer both parts for 45 minutes. So usually for part B, you could allot 10 minutes for that with 6 items, so that would give you around 1.5 minutes for each item. And then for part C, it also has 2 different extracts. Okay, so parang, oh sorry, I said a Tagalog word. Anyway, so it's like having 2 reading passages for part C. So in every reading passage, it has 8 items. So another 8 items, and then this time it requires you, inferential reading. Like when you read it, you understand it, so that you'll be able to eliminate the options, because it's all multiple choice. And the tricky part there is that they're going to use words that are so similar to the text, and sometimes even these are words that are found in the paragraph, but you really have to eliminate the other options, because those other options do not actually answer the question. Usually the kind of question is like it's the first half of the sentence, and then the second half of the sentence would be in the options. So you always have to go back to the main question. Okay, that's it?
So that's a trick.
Alright, so that's okay. For our reading test.
So
before I forget, you try to read medical journals if you want to enhance your skill. Yeah, like skill in inferential reading. Okay, so you go back again to medical journals. Please don't read medical surgical reference book. It's not the right material to study for OET. Okay, just more of healthcare journals, news. Okay, actually ABC News /health. I'm sorry, it's www.abcnews.au/health. You just try to Google it. Okay, you can browse through those websites. Okay,
so those are the news from Australia?
Yeah, but I think it has a counterpart in New Zealand. Okay? Alright, but my suggestion is to still continue exposing yourself for the Australian English, because it's an Australian test anyway. Yes. Alright?
Okay.
Okay, break mo na.
Break mo na. Still here. We're still here. We're gonna talk about...
Say hi!
Say hi!
Anyway.
So we'll talk about writing in OET exam.
Okay.
So,
you know what I like about the OET writing compared to the IELTS writing is that it's letter writing.
It's much easier.
In a way, but I don't
if you're in medical field.
Yes, of course. Yes. But I mean, like, the tricky part in the OET writing is your analysis, okay? Because you're given a case note. For you to have an idea what a case notes look like, it's like, do you remember your case presentation when you were in the 4th year college? Alright, isn't it that in the first few pages of our case presentation, there is a summary of the patient's case, where we have the patient's name, age, diagnosis, past medical history, until the discharge plan. That's what you're going to expect in the case notes. So most of the time, the problem lies within the understanding of the case notes. It's really important for the candidate to identify who you are writing to and why you are writing to that person. Okay? So it's always the two, the recipient and the purpose, because if you get them wrong at the very beginning, the rest will follow. Okay, so for example, this is a very common case. For example, like in your case notes, you're supposed to, discharge the patient to this nursing home, and then you forgot that actually the elderly patient has already come from that nursing home, okay? And then because you forgot about that, you included the patient's medical history, social history, and so on. So you have added irrelevant details to the recipient.
Because they already know the patient.
Of course,
Yeah.
the patient is
That's
already
good.
from the nursing home. So that's also one of the grounds why some candidates, even if they have impeccable English, all right, they get they get C+ or C because they have included irrelevant data. It's the same thing with a general practitioner. Okay, correct me if I'm wrong, but for general practitioners in New Zealand, are they also the family doctors?
Yes. Yeah.
Right? So if it is a family doctor, they already have a record of the patient, right?
Yes.
So if you're discharging the patient or you're asking for a follow-up assessment to the patient, to that doctor, okay, you do not include anymore the medical history, but some candidates do because they operate from a template. No, the wrong thinking here is that they memorize certain templates. Like if it is a discharge letter, this is the template. If it is an urgent letter for admission, this is the template, and so on. The templates are there to serve as a guide, but your understanding of the case notes must not adjust according to the template. It's the other way around. Like you have to understand why you're writing, and among all the people, why is it that it's really that person who's going to continue the care? What is that scope of responsibility of that recipient to let you, for you to endorse or hand over the patient, okay? It has to be included in his or her scope of responsibility. So for example, like for the social worker, so what is that scope of responsibility for a social worker, right? So obviously you have to, again, it depends on the case notes, but you would have, if it's a lifestyle, okay, it's really expected for you to endorse that to a social worker. Also his or her relationship, family relationship, and so on. Is there someone in his house who could be a caregiver, or does he need assistance from a community nurse, and so on? It has to adjust according to the again, to the scope of the responsibilities of the recipient. It's the same thing with writing to a doctor, okay, in different disciplines. So if you're writing to a hepatologist, there are specific data that the hepatologist must know, as opposed to a neurologist. So there's a different set of
They have different
data.
specialization.
Exactly.
Yeah.
So it's more of audience awareness. Okay? Alright? So that's what you need to know. The top two crucial questions, okay, that you need to ask when you are analyzing the case notes. Who are you writing to? And why are you writing to that person? How are you going to continue that? How is that person going to continue the care to the patient?
Alright.
Okay? That's for you, right?
That's very good input. Thank you for that.
Yes.
So the last category
Mm-hmm.
of the OET exam is speaking.
I
So-
love the OET speaking. You know why? Because if you just really imagine yourself that you're in the workplace, it just really is quite easy. Okay, in a way that this is what you really are going to do on the when you're trying to reassure a worried patient, when you're trying to teach the patient or convince him or her to undergo this treatment. So it's really,
So we can really use the therapeutic communication here.
exactly, exactly. All right. So maybe what you can do to prepare, number one, is to reorient yourself to what therapeutic communication is. Number two, try to view videos about nurse-patient communication. Okay, just for you to have an idea again, like, oh, okay, this is about therapeutic communication, being an effective nurse, being effective in communicating to the patients. And then the third one is to, I don't want you to memorize, but rather just familiarize the expressions for reassurance. Because there are only three major tasks that the nurse must do in the OET speaking. It could be reassuring, convincing, or providing health teachings. So what are those expressions that are commonly used when you reassure? Usually it's like, don't worry, or I understand what you're going through. I know it must be difficult, but okay. So you try to familiarize yourself with those expressions. If you need to write it down, the better, but I don't want you to memorize. I just really want you to fully digest it, okay? Expressions regarding persuasion, okay? Usually it's an if and then statement. Like if you comply with the medication, so we could see we could see the results faster. You'll get to recover much faster. Okay, so it's a if and then statement. And then you also commend if the patient adheres to or concedes already to your request. And then at the same time, for the health teaching, okay, I don't want you to bombard the patient with a lot of health teachings. You need to break it down, okay? Usually you start it off with, allow me to explain, let's say, allow me to explain what happens in diabetes, okay? And then you don't bombard the patient with all the information at once. You try to chunk it, okay? So let's start off first with what is supposed to be normal, okay? And then you talk about it, and then you have a follow-up check. You have a follow-up question like, so were you able to follow? All right. Do you have any questions first? Okay. So once it's clear, then you proceed to the next. So what happens in diabetes is that okay. So you learn how to chunk it so that you get to make sure that you call it interlocutor, okay? That the interlocutor would be able to again digest all of the health teachings that you were able to deliver. By the way, the person that you're talking to is not the assessor, okay? In the Philippines, usually it's a fellow Filipino who's also oriented to the medical English. All right, but they really are very helpful. Okay, I didn't have any feedback from my previous students who had a negative experience with their OET speaking. Most of the time, they actually like the interlocutor because they help. But as a candidate, you have to take charge of the conversation. I don't want you to dominate, okay? Because basically, unlike in IELTS where you really have to talk a lot, here in the OET speaking, it's a role play, it's a conversation. So
like
as much as
natural.
possible, as much as possible, you're able to ask the right questions so that you'll be able to elicit information from the patient, okay? So you're not supposed to dominate, but you have to take charge, okay? Don't wait for the interlocutor to guide you, to give you a hint. You have to take charge of it. So again, it's your job to initiate and maintain a number of inquiries, especially from New Zealand who needs help in the OET. And what I could say is that for things that you could learn from the website, of course, avail them, right? My job is more of the feedback, because it has to have a human aspect. Someone who is trained to assess and to guide, which areas do you still need to improve on. So hopefully, soon, probably in 3 months' time or in 6 months' time, we'll be able to launch it. And I'm going to contact him, and then let's see.
Yeah, we can place your thank you again.
Thank you, Rian, too. It has been 2 years.
2 years.
All right.
All right.
Okay. Thank you very much,
Bye-bye.
guys. Bye.